last speaker today is Lubna Abkany. She is a registered dietitian nutritionist and certified specialist in renal nutrition with over 20 years of experience. She specializes in chronic kidney disease management and diabetes focused on CKD nutrition. A mom, a kidney transplant recipient, and an effective nutrition communicator who loves eating and cooking delicious food with friends and family while balancing that with good health. Lubna's goal is to empower people to slow down their kidney disease with proven nutrition and supplement interventions. She quotes, "If I can give you more confidence in your diet, help you keep your kidneys, and give you more time to enjoy your life the way you want, I'll have done my job." Please join me in welcoming Lubna.
All right, thank you so much for that introduction. I hope I live up to your expectations. I was very happy when Lori invited me to speak today. The subject is a very big one. Following Dr. Paul is a little intimidating for me, but I hope I can justify some of what she has talked to you about. So before further ado, I think we can start. So the topic is how to lose weight safely, and that's exactly what we will be talking about. Can we move on to the next slide? So this just talks a little bit about who I am, what I do. Again, my name is Lubna Abkany. I live in Diamond Bar, California. I love to be in SoCal. I won't be anywhere else. I have a bachelor's degree from Cal State LA, and I have been in the field of dietetics for almost 30 years, out of which 25 have been dedicated to renal dietetics. So I've worked for different hospitals, and then I started working in dialysis. I've worked for St. Joseph Hospital in Orange. I worked for dialysis centers like Satellite. I've worked for Fresenius. At Fresenius, I was in a role of advocating for home dialysis, and I did that for 3 years. So I sort of have a very wide spectrum of experience. I've been doing private practice now for a little over 5 years. I started in 2019, just before COVID hit. But actually, COVID did me good because I could still teach and not be out there through Zoom. The other thing I wanted to just say that I belong to RSN. I sit on the board of RSN, as well as the National Kidney Foundation, and I am a member of the Academy of Nutrition and Dietetics and the Renal Practice Group especially. Moving on, my personal interests, like was mentioned earlier, I love going to the beach. I love being at the ocean. And I love cooking and eating, and of course, entertaining. And last but not the least, I love spending time with my boys. So just to give you a little background of my CKD journey myself, I was diagnosed with kidney disease when I was pregnant with my firstborn. And they found out that I was in toxemia, and that is what was affecting my kidney. So I had both my children are premature, and they've grown to the age of 32 and 28 now. And so I love being with them because I could have lost them in the process, or I could have lost myself in the process, and my boys would grow up without a mother. I was transplanted when my older one was in high school. He was in 9th, and my younger one was just getting into middle school. So, I've been blessed with a new life and a gift of life. All right. Okay, let's move on to the subject. Enough about me. So what is obesity? We talk about obesity. What is obesity? So the definition of obesity is accumulation of fat tissue. All right, simple as that, which will affect health. All right. Excess weight, best assessed by BMI. All right. And a normal BMI range between 18.5 to 25. And then anything above 25 to 30 is overweight, and anything greater than 30 is obese. But for this, all practical purposes for this talk, we are going to use obesity to cover both overweight as well as obese individuals. Moving on. So what are the trends of obesity in the world today? Increasing trends and prevalence of obesity is being noted in not just our country, but a lot of different countries around the world. And we now have about 1.4 billion adults who are obese or overweight. That's a lot of people. During the next decade, this number is expected to grow by 40%. And as we can all tell, that this could be attributed to the way we eat and what we are exposed to as far as eating. We are what we eat, correct? So if we are eating foods that are highly processed, if they are foods that are especially fast foods, we are going to gain that weight because that food is not really, the way it has been prepared is to keep its longevity, to keep it on the shelf for a longer period of time. They have a lot of salts added to them. They have a lot of chemicals added to them. And that could be the reason why we are in the state of obesity right now. So tackling obesity and CKD especially, obesity is associated with, if we can skip this slide and move on to the next, that speaks a little more about what it is. So with obesity and CKD, the hemodynamic effect of it is at the cellular level, at the intracellular level, there's hypertension. We talked about that earlier. There is podocyte injury. There is obesity-regulated glomerulopathy, and then, of course, the vascular effects of obesity on our bodies. There are different effects of obesity on the kidney. Type 2 diabetes, hypertension, and pulmonary obstruction. Pulmonary hypertension, that is when you get up suddenly, your blood pressure falls, your heart disease, all of these contribute to the CKD. And obesity can cause all of these comorbid conditions. I don't want to go too deeply into this. Let's move on to the next slide and talk a little more about what different, there were many different studies that were done, and this slide basically tells you who did it, what was the population, and what were the findings. And most of them, as you can tell from the slide, it shows that obesity alone is significantly associated with CKD. Go on. So again, with diet interventions, these were studies that were done and different diets that were tested in these situations and what they found. I think we can skip the slide just so that we are not running too late. We're already at 2:30. I don't want people to be away from their swimming pools too long. Pathology, again, the effects of obesity on kidney. As you can see, the worsening obesity can worsen your diabetes, your blood pressure, thus hurting your kidneys. Direct or indirect metabolic effects. Inflammation. Obesity causes inflammation that can cause your kidneys to be affected. Increased lipoproteins, increased abdominal pressure, fat infiltration into the kidney. All of these are detrimental to the kidney disease, right? Induction of glomerular hyperfiltration. Again, that is the GFR going high because there's so much pressure on the kidney from the obesity. All right, let's move on. So a lot of us talk about BMI and BMI as being the marker for obesity, like we spoke earlier. But in CKD, BMI has its own limitations, right? Why is that so? BMI cannot differentiate between your fat, your muscle, and your bone. Okay? Number two, body fat distribution. BMI can't tell you where the fat is distributed. And third, the difference between the ages and sexes. I mean, each one of us is a different individual. So just taking a BMI for CKD is not a very good marker. Let's move on. In the setting of kidney disease, you may have fluid retention. So a lot of us who are in stage 3, 4, 5, or on dialysis, we do tend to retain fluids. And maybe that's why the weight is high and BMI doesn't take that into consideration, right? Waist circumference is a more accurate reflection of your obesity. And that's why in transplant, that is what is given more weight. So BMI is less practical to use in the clinic, and it is less accurate. So doing more of the waist circumference is it's better for you. The risk factors of obesity throughout the different stages of CKD. So the number of patients that we have started on dialysis, we have found that 64% of them have a high BMI. Okay? And if this continues, it is predicted that 20% of the patients starting on dialysis will be in a state of obesity. And there are interventions and attempts are being made throughout the medical field to prevent obesity before you go on ESKD or ESRD, what the term was earlier, which is end-stage disease, which is on dialysis. Because that is what we have found. If we start early enough and be able to control your weight early enough, by the time you get on dialysis and you have other factors that are affecting you, if you have a good control on your weight, on your obesity, it is better for you. Moving on. So what are the basics of losing weight with kidney disease? And I have a cheat sheet here because my memory is shot. After 16 years of transplant and all those medications, boy, I'm telling you. So I have my cheat sheet here along with my points up there. So how can you lose, let's move this a little bit. How can you lose weight without making it very difficult? Let's put it that way. So it's no secret that we are living with kidney disease and that we have to make certain changes with how we eat and drink and how much of it we drink. So making these changes will help you protect your kidney and your kidney function and manage your weight better. Being overweight can lead to worsening. We have found that being overweight can worsen your health problems. Like your diabetes can get worse, your high blood pressure can be out of control, and these are risk factors for the kidney to go downhill. So if we can take care of this, we will be in a better shape. Fortunately, losing weight and following a kidney-friendly diet can help lower the risk of other complications and preserve your kidney function. Your doctor and your care team can help you. Always have your doctor send you to a dietitian who can help you put things together, give you ideas how to help you lose weight. Moving on to benefits of losing weight with kidney disease. So maintaining a healthy weight has been shown beneficial, as we saw from all the different studies that were up there, including increased energy, fewer health complications, and especially important for people who are dealing with kidney disease like us. The extra weight that you lose can reduce the stress on your immune and your cardiovascular system, helping you stay healthier for a longer period of time. Losing weight can thus help reduce your risk of type 2 diabetes, your high blood pressure, and If you're already managing these conditions, it will help you control them even better. So if you are on, say, 3 or 4 different medications for blood pressure, by losing the weight, you might be able to get off a couple of them. So as you all know, these medications also have side effects. If you have diabetes, losing weight has shown that you have a better utilization of the insulin that is being produced by your body or the insulin that is being given to you. Helping control your blood sugars is very important. As you lose weight, you will see that you are on fewer diabetes medications, right? As your blood pressure and your blood sugars are better controlled with your weight loss, all of these medications are then out of your system. Therefore, helping you to lose that weight is very important. All right, so besides this, I had 2 more points that I wanted to talk about, but I forgot to put on my slide. So, no, actually, let's see. Yeah, so the risks of rapid weight loss is what I wanted to talk about. We don't want too quick a weight loss, especially with medications, because what ends up happening is if you don't change your lifestyle or the way you think about food or the way you're eating the food, what ends up happening once you've stopped taking those meds and you start eating the way you did before, you're going to gain what you lost and some more. So that's called the yo-yo syndrome, and we don't want that. So you haven't gained that weight overnight, so don't expect to lose it overnight, right? You've gained it over a period of time, so slowly make those lifestyle changes to be able to slowly and consistently lose the weight and keep it off, okay? That is what our goal is, to keep that weight off long term, to give you the best health possible. All right, next slide. All right, so I just want to give you a few tips on how to manage your diet with CKD. So let's see. Choose fresh foods. As we know, foods that are canned have a lot of sodium in them. We don't want to use those because then the salt intake in your diet goes up. We don't want that. So every time you are choose fresh foods, fresh fruits and vegetables are healthier options for you. They are less processed. They are natural. They have a lot of fiber in them, and these can replace those processed foods for you. Read your nutrition labels, very, very important. And if not the whole thing, your understanding of it may be a little different, but I like to tell people to look at 5 things on the label. Number 1, look at the serving size, because that container could have more than 1 serving. Like, for example, I had a patient who came back to me and said, I found the perfect soup. I love drinking soup, and I found this perfect soup, which is very low in sodium. And it says it's heart healthy. All right, he brought in the container. I looked at it. Yes, lo and behold, everything that I generally look at on that can was fine. And then I asked him, I said, how much of this did you drink? And he says, the whole can. Obviously. And I said, yeah, but did you ever look at the serving size? It says this container has 3 serving sizes. This container has 3 servings in it. So you have to triple whatever you have on this nutrition label. It's not just what you ate. So this is not a very appropriate food if you're eating the whole can, but if you do just a part of it, you're all right. So reading the label to see what the serving size is very, very important. The next thing is monitoring your protein intake. Now, as we all know, in CKD, we have to monitor how much protein we are eating, right? So not just how much protein, but type of protein also matters. We have seen that those of us, there are 2 different types of proteins available in nature. One is from animals and the other one is from plant-based proteins. The animal-based proteins are animals that we generally eat are mammals just like us, and we are eating the muscle of that animal. And so that food is 100% absorbed by our body. Versus if we are eating plant-based foods, only 60% of that is absorbed by our body because we cannot break down fiber. We do not have the enzyme to break down fiber, and 40% of the nutrition in that food is trapped in the fiber. So eating plant-based proteins are better for you, will help reduce the risk of CKD, or in different stages of CKD, it helps the EGFR to be maintained or even improved on certain times. So animal proteins and plant-based proteins are two types of proteins. Not only are we looking at how much protein to eat, but also what type of protein to eat. Okay? Moving on, the next point is consider, again, a plant-based protein. Plant-based proteins are things like that come from beans, from lentils, from quinoa, thank you very much, from nuts and seeds, very high in protein. Now, oftentimes I get the question, but we have been told not to eat these foods because they're high in phosphorus. Who told you that these are high in phosphorus and animal-based foods are not? Right? So if you are eating animal protein, they are high in phosphorus as well. But when on dialysis, we ask you to eat more animal-based proteins because of the fact that during dialysis, you're losing a lot of protein and you want to replenish that protein. But in stages of CKD before dialysis, we advocate that you eat more plant-based proteins to help protect the kidney from the EGFR from going down. All right? Limit your calorie intake, right? When you look at the food, you eat with your eyes before you eat with your mouth. So make sure that your portion sizes are controlled, because when you eat more than what your body can handle, that's when obesity happens. You've got, it's simple, garbage in, garbage out. What you eat needs to be used. If it's not used, it's going to accumulate, and you're going to have an excess amount of calories are going to give you excess amount of fat. Remember the triglycerides that we talked about earlier? Triglycerides, what are they? They are sugar molecules that get stuck to each other. 3 sugar molecules get stuck to each other, they resemble fat. That's where triglycerides come from. So if you can reduce the amount of sugar or carbohydrates that you are eating, the type of carbohydrate, again, a higher fiber carbohydrate rather than something that comes from white rice or white bread is a better carbohydrate to eat. But again, you can't eat 6 slices of it, right? Because that's going to be in excess. So keeping your, not just, again, what you're eating, but the portion sizes under control is very important. And exercise. Make exercise a routine, your daily, and I generally use this. A lot of my customers or my clients or my patients laugh at me when I say, the day you don't eat, you don't need to exercise. If you're eating, you need to exercise. So when somebody comes up and tells me, my doctor told me to work out 3 days a week. Do you eat only 3 days a week? No, you're eating 7 days a week. So incorporate some kind of an exercise. It doesn't have to be jogging or running or whatever else. You could walk 20 minutes, 30 minutes, start with that. You could swim, you could bike. All these are exercises that are considered aerobic exercises, and what they do is they're using the larger muscles of your body, which in turn use a lot of sugar, and so they regulate your sugar better. They regulate, and then you don't have that metabolic syndrome to deal with once you start losing the weight. Okay, so add an exercise. You could change it up, One day I'm walking, another day I'm biking, another third day I'm swimming, and then you can rotate that as and when you please. But definitely 30 minutes on a daily basis would help you consistently lose that weight. So calorie deficient diet as well as exercise together is going to help you lose the weight and keep it off. Okay? Next slide. So just to give you a little idea as to what are serving sizes, right? I like to use a palm for different things. So if you're eating vegetables and fruits, use your fist. Your heart and your kidney is the size of your fist. So eat based on your fist. Simple as that, right? Non-starchy vegetables. Now, if you're talking about potato, you're talking about corn, peas, lentils, all of these are starchy vegetables. They come under your starches or your carbohydrate-rich foods. Okay? Non-starchy vegetables is broccoli, cauliflower, asparagus, Brussels sprouts, things, cabbage, things that are not very high in calorie but very high in fiber. Cupping your hand, whatever fits in this cup is your serving size for starch. Okay? Whatever fits in the palm of your hand is the size of the protein you will eat. Again, same thing with the beans, half a cup of beans or lentils. Thumb size for your, that is 1 tablespoon of oil or fat that you're using. And then the fingertips is one teaspoon. So when a recipe calls 1 teaspoon, that's how much you're putting. All right? So this is a good handout just to give you an estimate to eyeball. But measuring, initially I recommend you measure the foods, but later on as you get a little more comfortable, visualizing is a better deal. Move on. Mindful eating techniques. So being mindful about what you eat, when you eat, how you eat. Make sure that you sit down to eat. You're not running on the fly. Not a good idea, because then you're just scarfing the food down. And remember, when you're scarfing the food down, you're not chewing. And when you're not chewing and that unchewed food goes in the stomach, your stomach does not have teeth. No teeth in the stomach. Okay? And then that undigested material sits in your gut. And then it sits in your colon. And then you're having issues with gas, bloating, constipation. We don't want that. Take a good 15 to 20 minutes to sit down. Chew your food. Chew it well. What that chewing also does is, there's a connection between your brain and your stomach. So chewing, it is having your mouth get a little tired. So the mouth is sending a message saying, hey, I'm tired. And the brain is sending a message to the stomach, you're full. Okay? So be conscious when you're eating. All right? So these are some of the techniques that I teach people to do. More color, more texture. The higher the color, the higher the texture, the better food it is for you. So as far as the vegetables and the fruits, more colorful vegetables and fruits are better for you. Try eating your foods that require utensils, because by the time you pick the food and put it in your mouth, it's a little difficult, rather than you have something hand to mouth, right? Okay. So these are some of the things. And then gauging your hunger is very, very important as well. If I have eaten a stomach full of food, I've overeaten. Remember that. Always think of your stomach and think of it in three little sections. A section for food, a section for water, a section for air. You need to breathe. So don't fill your stomach to the point where it's difficult now to walk, to breathe, to do anything. Right? So, and I always tell people, start with water. Start with water. So a lot of food, or a lot of your stomach is already full. And then when you're sitting with your food, your tray should have, half of your tray should be vegetables and fruits. Okay? Start with your vegetables. high in fiber. By the time that goes down the hash, then go move on to your protein. By the time that goes down the hash, everything is ready. The fiber has been digested a bit, and it's waiting to catch all the sugar that's coming down from the carbohydrates. Your carbohydrate portion should be the smallest and eaten last. So that it could be that that brain is sending the message to the stomach saying, hey, I'm full. I don't need this carbohydrate. Or I'll eat only a part of it and I'm done. Okay? So be mindful of where is your hunger. Don't skip meals, because when you skip meals, the next meal is going to be much larger because you're so hungry, you're going to just want to eat and eat and eat, and then you're overfull and you're not helping yourself. So never skip meals. Don't skip your breakfast. Your breakfast is the most important meal of the day. You have already fasted for about 14 hours. So if your last meal is at 6 p.m., your next meal should be no later than 8 or 9 a.m. the next day. Okay? Now, a lot of people ask me about intermittent fasting at this point. And what I tell people is intermittent fasting is great, but you can't do it every day. It doesn't work. Because your body gets used to that. And it's, that's a piece of cake. I don't need to do anything more. So doing intermittent fasting maybe twice a week is a better option than doing it every day. Okay? And again, intermittent fasting is not eating a breakfast too early, maybe waiting a couple more hours and having a small breakfast, and then, maybe skipping a lunch, skipping a snack and moving on to lunch. Because I generally teach people to eat smaller, more frequent meals rather than 3 large meals. Okay? Let's go to the next slide. So a lot of times people talk about the DASH diet or the Mediterranean diet, right? And it's very, very beneficial for the heart and for the kidney. Because if you look at the proportion of foods that the Mediterranean or the DASH diet gives you, maximum amount of whole grains and multicolored fruits and vegetables, the lean protein would be more of proteins coming from chicken or fish than red meat. Okay? And it's a very small portion for the whole day. And then more of it will come from plant-based, like your legumes and your beans and things like that. Fats, very little fat. And dairy is good, but again, no more than 2 servings of dairy. Make it low fat, because you're trying to burn the fat in the body. Okay, it helps with lowering your blood pressure and so on and so forth. Next slide. So what is the DASH diet? It's 27% calories, 6% of calories coming from saturated fat. I mean, this is a slide that I found that really depicted well what the DASH diet does. Okay? And what it basically does, adherence to the DASH diet or the Mediterranean diet significantly lowers your risk for CKD. Again, because of the fiber in the diet. All right? Amongst 1,100 adults that were studied over the age of 20 with hypertension and CKD, what they found was being on this diet helped them either maintain their eGFR or improve their eGFR. Okay, move on. So what are the general guidelines of a DASH diet for CKD? Again, focus on plant-based foods as much as possible. Limit your processed foods. Processed foods is anything that comes in a package, a box, or a bottle, or a can. Okay? So a lot of people ask me, hey, what about frozen foods? Yeah, frozen foods, if you're picking up vegetables and fruits in the frozen section, it's okay. But if you're picking up those boxed foods, the boxed, like your healthy choice or your, again, read the label. Make sure that those 4 things, especially the sodium, the cholesterol, the saturated fat, and the added sugar are much lower. Choose lean protein, chicken, fish. Incorporate fish maybe 2 or 3 times a week, even better. Next, monitor your potassium and your phosphorus, especially for those who are on dialysis. Very, very important, because we don't want those to go up. If you have a phosphorus restriction, now you talk to your dietitian. If you are on dialysis and you are on a phosphorus dietary restriction, you can still incorporate those vegetarian proteins. It just needs to be tweaked for your diet, and your dietitian can definitely help you with that. Okay, don't try to do this without somebody on board to help you. Stay hydrated. Very, very important to flush your kidneys consistently of all those impurities and the fats that are burning, because those will have components that need to get out of your body. If you are on a fluid restriction, make sure you stay within that. Otherwise, that extra fluid is going to affect your heart. You don't want that. Okay? If you are not able to maintain your phosphorus without phosphate binders, take your phosphate binders with your meals. Not half an hour after the meal, when the meal has already moved out of the stomach, because those phosphate binders work only in the stomach where there's acid. Without acid, the phosphate binder cannot break down, and it will not, it doesn't have that affinity to bind the phosphorus. So if the food has moved on to your intestine, that phosphate binder is of no use. Okay? So again, remember to take your binder. If you can tolerate the binder before you eat, that's the best time. Because by the time, like I said, by the time you're chewing the food and everything goes down, and when the things that really have the phosphorus matter comes down, these binders are broken up into little sponge-like structures waiting for that phosphorus to be absorbed. So take it before the meal. That's the best. If you can't tolerate it before the meal, take it in between the meal. Take a few morsels and then take the binder. Or if you forget to do it before or in between the meal, take it immediately after you've eaten. There'll be some efficacy with that rather than forgetting it for half an hour and then taking it. Okay? Move on. Next slide. So what are the key considerations? Everybody is not the same. So we can't give one diet and say, hey, this is going to work for everyone. No. Work with a dietitian. Get your diet individualized to your situation, to your issues, to your problems. Okay? Again, phosphorus, potassium management, very, very important, because as you know, if there's a high potassium level, it's going to affect your heart. If it's a high phosphorus level, it's going to affect your bones. We don't want either. Sodium restriction. In general, an American diet has 3,000 milligrams of sodium or above. Sometimes it can go to a 5,000 milligram diet, okay? But to keep your heart healthy and your kidney healthy, all of us, general population as well as CKD population, as well as cardiovascular population, we should restrict our sodium intake to no more than 2,000 to 2,300 milligrams of sodium. Now, that being said, people are like, okay, so what does that translate into food? Tell us about food. How does that translate to food? So how does it translate is, naturally your food has a lot of salt in it because it grows in the ground, or you're eating foods that eat from the ground. So the sodium content of your meals are adequate for you. The only addition is it could be a 1/4 teaspoon of table salt if needed. But if you can get by without that, even better. Okay? That's what it translates to. Protein intake, make sure you're eating in adequate amount of proteins on dialysis, pre-dialysis. So there's a formula we use for dialysis patients versus those on CKD. If you are from stage 3 and to 5, we generally use 0.6 grams of protein per kilogram of body weight. That's how we calculate how much protein a person should eat. In a normal American diet, we eat excess of 1.5 grams of protein per kilogram of body weight. Because you think about it, when you go to a restaurant or when you go buy food, your steaks are how large? 12 ounces, 16 ounces. If you're in Texas, it could be 20 ounces. Right? Imagine this. I had a Texan who came to me, and I'm telling him first not to eat red meat, and then telling him if you do eat red meat and if you do eat a steak, stick to a 3-ounce medallion. That man almost got up and slapped me. It was good we were doing this on Zoom. That's why I'm here to tell the tale. He says, 3 ounces? That's not going to even touch my molar. Like, I'm telling you what's good for you. Now it's up to you. You're an adult. You do what you do. But I'll tell you what I need to tell you, right? So again, protein intake is important, but not in excess, okay? Consult with your healthcare professionals. You have to have your team on board. You are the center of a circle. You're the center of attraction. Let's put it that way. And your team is your doctor, your nurse, your social worker, your dietitian, and your technician if you're on dialysis. Do not do anything without that team knowing what you're doing. Because they are there to support you, to help you through that journey. Right? So don't try to do this on your own, because you could do it very drastically and you could hurt yourself in the process. Okay, next slide. So this is just a small slide that I kind of cut. I said, okay, from stages 1 to 2, we need to eat moderate amount of protein. Again, we are not doing very high limits of protein. We don't want to eat those medallions even on a daily basis. Okay, you're doing your cup size. Okay, so moderate amount of protein, monitor high levels of potassium and phosphorus, just to be safe. Calcium also needs to be looked at. You may not need the restriction at this stage, but just be aware. Stages 3 to 5, which is the latter stages, definitely low sodium, low to moderate amount of proteins. Avoid very high potassium foods if your potassium is elevated. Avoid phosphorus additives, so no packaged, no processed foods, because that's where they are. Avoid high calcium foods if your calcium is starting to go up. That means there's some dystrophy going on in your kidney, in your bone. Okay? If your phosphorus starts to go up, your calcium starts to go down, your PTH starts to go up, you have to manage that. You have to be very on top of it. And then fluid restriction if you are on one. Make sure you're following it. When on dialysis, most of these stay except the protein. So low sodium, low potassium, low phosphorus, high calcium, because you want that calcium to be maintained to help the bones from getting destroyed or deteriorated. Fluid restriction. The only thing is higher protein, because during dialysis, you're losing a lot of protein. So you need to replenish the protein, okay? And then post-transplant, for those of us who are fortunate enough to get a transplant, the low sodium, if you look, the low sodium will stay all through the stages. It's the best, so that way you can manage your high blood pressure as well as you're not retaining fluids. Moderate amount of protein, because now we can process that protein. The kidney is able to get rid of it. Monitor your high potassium, high phosphorus. Again, as the kidney may start to diminish a few years down the road, make sure that you are still within the good goals. And then your calcium again. So be aware of your surroundings, be aware of what you're eating, because ultimately you are what you're eating, okay? And remember this, a moment on your lips, a lifetime on your hips. All right? So take-home points, just a few. There is a complex and bidirectional relationship between excess fat, dysfunction of your fatty tissue, and your CKD. That is point number 1. Two, point number two, now I did not touch on the medications that are out there right now, the SGLT2 and the GLP-1s and all of those, because that is a whole different topic. So I did not want to indulge in that, but talk more about the food and how you can manage your diet and exercise and bring your obesity down. Number three is nutrition intervention for people with CKD, and obesity needs to be tailored. It needs to be tailored by a professional, okay? Please do not try to do this on your own. And it needs to be tailored to your health conditions and your problems, all right? And last but not the least, treat obesity in patients with CKD to improve the health outcomes. That's our goal. And to get access to that renal transplant, because those guys go by the girth of your body, right? They go by the circumference of your hips, of your abdomen, sorry. And so let's work on these things. Let's try to lose the weight sensibly and happily, and don't forget to exercise. 30 minutes of exercise on a daily basis. And as you get used to that 30 minutes, try to increase it by 10 minutes. Because the body is a very strange thing. It gets used to things. And once it gets used to that 30 minutes of exercise, it says, ha, what a piece of cake. I can do this. No problem. I keep my eyes closed. But then you want it to keep losing the weight. So keep increasing your exercise. That way your heart will get stronger, your kidneys will be better. Overall, you'll be in a better health.